Okay, so we're going to calculate a tube feeding for an adult patient. So we're just going to press adult on the home page, and then we're going to enter male in the top corner, and then we're going to put our height in inches, 72 inches. Then we'll put in his weight of 200 pounds. Now we'll put in his age, 55, and our patient has an amputation, so press the amputation button and take away his leg, the bottom, press OK. Now we'll have all our information there, so we're going to press submit. Now we'll calculate our patient's nutritional needs. And you can see there's 4 choices here: adjusted ideal body weight, actual body weight, Mifflin, and Penn State. The correct Penn State formula will come up depending on your anthropometric. We'll just use adjusted ideal body weight today. So we'll just tap that and we'll do 25 calories per kg. For protein, we'll give him, again we'll use adjusted ideal body weight and give him 1.5 grams per kg. Now we'll look at his fluid needs, and the choices there also age-related, custom adjusted ideal body weight, custom actual body weight, or fluid restriction. We'll use age-related today, and we'll just press that and it will automatically calculate his fluid needs. Our patient is going to be on tube feeding, so we will press tube feeds down on the bottom right of the screen. Right now we're on the tube feeding page, and we're just going to tap for product, and it'll pull down a list of your formulary, and we'll just be using sample 1.5 today. And you'll see, if we pick sample 1.5, it lists all the substrates, but at the top of the page you'll see that what calories and grams of protein have been delivered, as well as the free water amount. We'll see that we're short 36 grams of protein, so that's not going to work for our patient. We're going to need some more protein. So we'll press the modular button and we'll enter our modular information in the boxes. Our modular contains 60 calories and 15 grams of protein. And then go to the arrow buttons and press on them until you get the correct amount of protein that you want. In our case, we're going to have probably 2. And then press the bottom button OK, and that will tell us our new amount of protein and calories. We're over 134 calories and short 6 grams of protein. However, our patient is also on the vent and they'll be getting Diprovan, so we're going to press on the propofol button and we're going to enter the rate in ml per hour that the Diprovan is going at. So our patient is getting 22.5 ml per hour of Diprovan. Put that in and press OK. Now look back up at the top and you'll see that the calories are over by 729 calories, which is way too many, so we're going to have to decrease the rate using the arrow buttons at the top. And when we keep pressing on the arrow buttons until you get down to a rate that's a little bit more acceptable. In our case, that's probably going to be somewhere around 40 ml per hour. So when we do get down to 40 ml per hour, we see now again we're short protein on 30 grams. So let's go back to our modulars and we'll press on that again. And then we'll increase our modular protein packs up using the arrow buttons until we get a better level of protein. So we can see if we go up to 4 packs, we're now at 0 negative for protein, so that's great. And we'll see that our tube feeding will be at 40 ml per hour, and we'll be having 4 packs of protein modular with that, and our water flush will be 305 ml Q4 hours. We are over by 272 calories, but that is acceptable for our patients. The Enteral Calculator has numerous help files. Just select Menu on your device. Ours is the 3 dots at the top right. There are also multiple edit options, so just press edit at the bottom of the page. Now you'll pull up the tube feeding products and the formulary substrate. For the tube feeding product, it's going to be add new, edit substrate quantity, edit product name, or delete product. Under the substrate, there's add substrate, edit substrate name, or delete substrate. You'll need to add your own formularies to the app. Press Add New and type in the name. Saving here will produce an error message. You must enter at least kcals, protein, and water. Then, to enter substrates, press on substrate quantity and enter the quantities in ml. For example, 1.2 ml for kcals, 0.063 for protein, and 0.75 for water, which will be 75%. Then press Save. You can edit substrate quantities for a particular formula. Tap Edit Substrate Quantities, then tap for Product. We'll select the formula we just added and change kcals from 1.2 to 1.5. Tap Substrate Quantity for kcals and enter the new value. This is automatically saved. You'll want to delete the sample formula that came with the app. As an example, we'll delete the formula that we just added. Tap Delete Product, select Formula to delete, and then select Yes. Please read carefully the important text at the end of this video regarding formula substrates.